Today we're going to take a few minutes to talk about gaze preference in large vessel occlusion strokes as an innovation in patient care. Now you're all familiar with the pre-hospital Cincinnati stroke scale, and we'll continue to use that when assessing patients for signs of a stroke. Remember, that includes facial weakness, whether that's facial droop or asymmetry, arm weakness, whether the arms drift or cannot move when outstretched with their eyes closed and their palms up, or speech abnormality, and that can include slurred, otherwise abnormal words, or even absent words. Now, in addition to assessing the Cincinnati Pre-Hospital Stroke Scale, in many cases, the presence of a gaze abnormality may be significant in identifying a large vessel occlusion stroke. That is a type of stroke that has significant effects on the patient's presentation and may benefit by an intervention called an embolectomy. So when assessing a gaze abnormality, we're looking for one of two things. The first is we're looking for evidence of gaze deviation, and that's where the eyes are deviated at rest to either the patient's right or their left, and the patient has no movement of those eyes when they're asked to track an object. The other is something called gaze preference, and that's where the patient may have a gaze that is straight ahead while at rest, and the patient can track an object to one side when asked to track the object horizontally, but they cannot move their eyes past the midline when tracking it in the opposite direction. Now, this can occur either to the right or the left side when you're assessing for gaze preference. So to put this into perspective, we're going to watch a short video on how to assess for evidence of gaze preference or gaze deviation.
Hi, today we're going to talk a little bit about gaze abnormalities and assessing those abnormalities in the field. So in order to assess for gaze deviation or gaze preference, I thought it would be important to first look at a normal gaze. So in testing this, you first look at the patient and see where their eyes are at rest. And someone who has normal gaze will likely be looking straight forward, eyes nice and symmetric. To test the eye movements, you hold a target out in front of them, like your finger, and ask them to follow the finger from left to right. So the eyes go all the way to the left, and then all the way to the patient's right, and then back to the center, and the eye movements are nice and smooth, and they get completely out to the left and completely out to the right. In the setting of a gaze deviation, which might occur in a large stroke that could be suggestive of a large vessel occlusion, the eyes at rest would be deviated to one direction or the other. In this case, the eyes are deviated at rest to the right. And in this case, you would say that this patient may have a gaze deviation to the right. You can test to see eye movements in this patient by doing the same thing as before, holding your finger up in front and asking them to follow it from left to right and right to left. And in this case, our patient appears to be looking only to the right and does not track the object even to the midline, or certainly not to the left, and this would be indicative of a right gaze deviation. So the last type of abnormality regarding gaze is a gaze preference. In this case, the patient may be looking straight forward at rest, but when you ask them to track, again, a target in front of them, like your finger, and in this case, I'll have the finger move to the patient's right, and in this case, the patient is able to track that way, but as you go back toward the center and then across to the left, the patient doesn't cross the midline. This could be termed a gaze preference, also suggestive of a potential large vessel stroke, similar to a gaze deviation.
So what does the presence of a gaze abnormality mean in my assessment and management of a stroke patient? Well, if you've identified signs of a stroke, we still want you to make pre-arrival notification calls to your receiving hospital for a possible stroke when the last known well time is within the last 24 hours. And the reason for that is that the potential window for treatment is now much broader than the original 3, 4, even 5 hours. And when you're providing that stroke notification, continue to provide the time that's last known well, provide the Cincinnati stroke scale findings, but you may also be asked about a gaze abnormality. The reason that you may be asked about this is because the presence of a gaze preference or deviation may suggest the presence of a large vessel occlusion stroke, and those patients do better by being treated at an endovascular capable facility. So your protocols right now expect that every stroke patient is taken to the nearest available stroke center. And so now, as we learn more and more about the care of stroke patients, if your patient has all of the Cincinnati stroke scale components being abnormal, meaning they have facial droop, they have arm weakness, and they have speech abnormalities, and they have a gaze preference or gaze deviation, the receiving facility, if it is not endovascular capable, may request that you divert transport, if appropriate for that patient, to an endovascular capable facility. Now, in the Monroe-Livingston region, that includes Rochester General and Strahl Memorial Hospitals. These are hospitals that have not just the ability to provide thrombolytics for stroke care, but also have neurosurgeons that can perform the endovascular embolectomy that's necessary to manage these types of stroke. So this is a burgeoning and new concept of utilizing different assessment tools to identify patients with large vessel occlusions. This video is simply sharing the assessment tool of how to assess for a gaze abnormality or a gaze preference, so that if you are asked about this during your medical control consultation or pre-arrival notification, that you know how to assess it and what that might mean, as well as how this may play a role in the patient's ultimate destination choice. As always, with any questions, don't hesitate to reach out to the Division of Prehospital Medicine at the University of Rochester at the phone number or email below.